get started. Good to see everybody. Haven't met in a while, but there's been a lot going on. We've got a pretty full agenda today. And so we're going to start with the media campaign update, as Rocio was mentioning while we were convening this morning. If you've looked around, you've seen the billboards have gone up. We've seen them all over town. I see the TV commercials every day, and so those are awesome. So we're seeing a lot of that stuff start to move out. So I'm going to actually turn it over to Danny, who's going to tee up her and Gail about kind of where we are right now. I want to sort of give everybody an update on what's been going on and kind of what the plan is moving forward. So, Danny, I'm going to turn it over to you.
Okay. Thank you very much, Dina, and I appreciate being able to talk to the roundtable and update them. As I think everybody already knows, the Count on Me CLT campaign is well underway with sort of the first round of media buys and commercials and other efforts that have been made with that. I think you're starting to see a lot of it. And then a few weeks ago, the County Commission also gave us additional funds, $500,000, to augment to more, particularly community relations, community engagement, as well as marketing, which is a lot of what this campaign already includes. So today, what we're going to show you, and I'm going to turn it over to Ray Ward and AC&M to actually go through a few slides, is what we think we need to do with at least the first phase of this money, and try to really put our foot on the gas pedal and use the creative that we already have and expand it and try and get as much with these key messages. So with that, I will turn it over to either Gail Cox or Jennifer Appleby.
Okay, Danny, thank you. I'll take it. It's Jennifer. We're going to run through where we are, as Danny mentioned. Really excited to have this broadened relationship with the county and bringing their strengths with ours and some additional resources. So everyone knows this is an awareness and education campaign designed to help spread COVID by messaging around the safety guidelines. We're doing that through a broad scale media campaign, but also we're leveraging targeted media and messaging that really engages our special and targeted segments in a relevant and meaningful way. And you've seen some of that work. Also developed a resource hub that is countonmeclt.com, where our citizens can go and find additional resources. We did develop a toolkit of all of these campaign assets. Hopefully you all have received that and you're utilizing and sharing those assets within your organization to help us really amplify the message even further. And then our job is just to continuously optimize and evolve the campaign. And you're going to see some of that today. So from a broad scale efforts to date, Dina already mentioned, we got lots of, along with some great added value with on-air interview segments. And we're aligning some thought leaders and to go on to those segments. So that's been great. Out of home, the billboards are everywhere, and we'll talk about the targeted elements in a minute of that. We kicked the campaign off with print, with the Business Journal. We're also going to be running in Q Notes, and then we've added additional print executions. And then from a digital standpoint, the Charlotte Agenda has been a great partner, and we've got some paid banner placements. I wanted to share the new television spot we just shot. Rocio, you will see superstar, and thanks to Tom and his team, we were able to secure Mike Rucker to also appear in the spot. So it's a great cross-section of diverse community members sharing the message, and here it is.
We need your help. Coronavirus is still here, and we have to stop it from devastating our families and our economy. Please wear a mask. Please wear a mask. Please wear a mask. 6 feet apart.
And wash your hands.
These simple actions, you can help save our patients. My job? And my mom. We're all counting on you.
So that's the second TV spot we created. That's going to be working into rotation over the next couple of days. In addition to that broad scale paid media, we're also doing some creative things, including the Count on Me CLT window mural initiative. We're working with the 4 chambers and Charlotte is creative and local artists to develop business window mural messages. So the chambers have been great. They're helping us identify businesses that have highly visible storefront windows. And we think it's a great opportunity for engagement, PR, and possibly even mass distribution while those murals are going up. So that will be happening over the next couple weeks. And then we're really gearing up our social media strategy and branded social pages. We have brought on another small business partner, a group called Black Wednesday. They're going to be really kind of leading and coordinating with Ray Ward and ACM on the content we're developing in developing these branded social pages and sharing messages, stats, myth busting, influencer reposts, and then other content. So we're really excited to get that moving ahead. So I'm going to turn it over to my partner, Gail, and she can talk about some of the targeted efforts.
Okay, thank you, Jennifer. So as you all know, there is this broad scale layer that while it attempts to appeal to everyone, which very often tends to not be focused on people of color, Jennifer and her team have done an outstanding job making sure that those assets represent the population here in Mecklenburg County. But above and beyond that, given what we know about how this virus is disproportionately affecting people of color, we wanted to do some heavying up and with some very targeted efforts. So specifically for our targeted efforts, we do have targeted out-of-home, radio, paid social, and digital. There are targeted assets on the toolkit. We have a Spanish language version of the website. We have targeted print, and we also have targeted videos and interviews. Now, just to give you a sense of what I mean by each of those, for instance, for the out-of-home, we worked very diligent with the media team at Ray Ward to ensure that we had placements in the areas that we knew had a very heavy African-American, Hispanic, Asian, or LGBT community. And what we did was to then make sure that there were boards that spoke to each of those audiences in a very culturally relevant way. Just to give you a sense of that, obviously you've seen the Mask on Mac. I think that's actually turned out to be one of the most popular ones, and that copywriting was done both with our team at ACNM and also with Javier Phillips. But then also things like Masks Don't Keep Your Voices from Being Heard for boards that we put downtown for where protesters are. And then for the Hispanic population, the translation of what you've seen is that this fight will be won with masks, or this fight will be a clean hands fight. And that's really referencing the fact that while everyone knows how popular soccer is, the sport of fighting is one of the second most popular sports within the Hispanic community. And so it's really leveraging that passion point and those cultural cues to tie it into something that's really meaningful to them. For the radio, we have 3 African-American spots and 3 Spanish language spots. We placed with Beasley and Norson, and we even were able to engage Miss Jessica, a radio personality with Beasley Media, and really leverage what she's doing with her nosy neighbors. She recorded one of the spots for paid social. We actually, in addition to having the assets, we actually put some paid money behind them. And we know that we've reached about half of the African Americans and about 2/3 of the Hispanics. One of the things that we've pushed in addition to the campaign messages is some very targeted messaging that addresses barriers that they specifically have. So videos that have been made available by the North Carolina Department of Health and Human Services that leverage Dr. Bianchi, and those are in Spanish and in English, and so we were able to boost those, and in the first week alone, we got over 700,000 views on that. The toolkit access was shared with the Latin Chamber, the African American Chamber, LGBT, Carolina Business Alliance, and the Hispanic Contractors Association. And on targeted print, we've started to place some ads in the African American and Hispanic targeted media, and we'll do more of that in the next phase. But we've also developed info sheets that have been very helpful. Thank you to the Atrium and Bond teams for collectively giving us feedback and input so that we just got those approved yesterday. So we'll be distributing those out into the community in various translated languages. And lastly, in terms of videos and interviews, we know that with African Americans and Hispanics in particular, having two types of messaging are most critical, especially in a healthcare situation. The first one is having testimonials of people who have been affected by the disease. That's why we're so excited about being able to work with Ms. Jessica, but there will be others that you will start seeing in terms of testimonials. And then having messages from respected, relevant thought leaders who are medical professionals. So basically think of it as our very own Dr. Fauci within the Charlotte community. So those videos are also in progress. So from here, what we plan on doing is, I provided a couple of charts to show you where we are on the curve. And so interestingly, it depends on who you are as to whether you decide that that looks like the trend is going down or whether it's going to bounce back up. But we are all collectively determined that it is going down and that this is all about really putting our foot on the gas and making sure that we're stopping the spread from here. Kids are going back to school. So we will be using all of the assets that you see listed there. Probably about 2/3 of them are assets that have already been deployed. We'll be heavying those up, increasing the frequency of the message and the reach of the message, but then also adding some of the things that Jennifer touched on. So now I'm going to let Jennifer give you an overview of what we're proposing is really part of that heavy up messaging that you have not seen yet, but is in progress.
Yeah, and we're really excited. I think that we've taken an incredibly innovative approach to some of these recommendations. As you can imagine, with the political season coming up, a lot of the available inventory with media has been gobbled up. So we're utilizing some kind of really cool, innovative ways to reach our audiences. So first and foremost, we've talked about digital. We're gonna really sort of leverage and dial up our efforts on Facebook, Instagram, and put Tinder into the mix for the months of just August and September. We know that our young audiences are there, so we want to make sure our messages are there. We're going to go with some streaming radio with Spotify, and you can really target by types of music our audiences. And we know that, again, the young audiences are there. Over the top television is streaming television. So we're going to, put some money against streaming TV. Clean Graffiti is a really kind of cool, innovative, it's a local business. So again, we'll be supporting local business, but it's using kind of power washing to put messages in unique locations. And so we've got them on board. The Charlotte Ledger is a business newsletter. And so we're working with them to get some messaging out through email sponsorship. We want to expand our out-of-home messaging with cats. And so thrilled to be able to do that. So we're developing those messages now and then working closely with our friends at Center City Partners. Thank you, Michael Smith, to get the messages in those locations uptown through the kiosk posters, some of the pole banners, and others. So we feel really excited about how we're going to extend the message with some of those innovative media recommendations. And for the targeted, Gail?
So Jennifer's team has made sure that we are talking to the audiences, in particular with a couple of the tactics that she mentioned. The Tinder will be very relevant for the targeted audiences as well as Spotify. But above and beyond that, we want to make sure that we had heavy up media with the things that we know people will have access to. Unfortunately, this virus, as you know, has affected us not only physically, but also socioeconomically, and the unemployment rate is very high. And so we wanted to make sure that we were leveraging first and foremost methods that we knew would reach people no matter what their financial situation was. So in terms of traditional radio, we will heavy up there and expand our coverage to more stations within the African American population. For paid targeted social and digital, again, we'll go beyond Facebook and Instagram and also look at leveraging YouTube, to share some of the videos that we have from some of the medical professionals. We'll be looking at email distribution of those videos, really tapping into influencers and paying them if necessary to distribute through those individuals who have very large reach. Also looking at using Spanish Google AdWords to make sure that anyone who is searching within Mecklenburg County for certain keywords related to prevention, testing, contact tracing, et cetera, that they can quickly and easily be directed to the information that they need. We have a buy with Telemundo. We'll be transadapting some of the spots that Jennifer has shared, and then also trying to leverage some of the video content from the doctors. And then expanded grassroots, really, the toolkit asset, the asset of the toolkit with assets that already exist has been very helpful to the shorter list. I'm going to say shorter, it's dozens of organizations, but to what relatively considering is kind of a shorter list of organizations. And so this is going to be an aggressive push to make sure that every church, soccer league, sorority, fraternity, every contractor, in terms of for the construction contractors, business owners, that everyone is aware that those assets are available and help them push them out through their organizations, and even have street teams going around, obviously completely protected with PPE, going to food trucks and businesses and sharing sticks that they can put the message of the 3 W's, or what we now refer to as the 3 M's for the Hispanic population, make sure that it's front and center for them. And then lastly, expanding our print rotation to include Lago County News, and also on those websites and social media channels for those publications. So that is our expanded request and recommendation to make sure that we all are really putting our foot on the pedal. If there are other ideas that you feel live within those, or other things that you think are critically important that you want to share with us, and we can see if it makes sense to shift any money. These are the things that we think are most important, but we're open to ideas and also open to your questions or concerns. So are there any questions?
Dina, this is Mohammed Janatian. As long as we're working on a public relation campaign, I think we need to focus on one other thing. I got a call this morning from one of my hotel owners asking me for the cell number for the restoration company. And when I asked him about what's going on, he said, I need to do a suicide cleanup. And I reached out to this company, and I told them what's going on. And she told me that unfortunately, they have been getting a lot of calls lately within hotels, and particularly apartment complexes and condominium complexes with doing cleanup for suicide. I think we need to somehow reach out to people and let them know that there is help available before they actually commit suicide.
Yeah, that is a tragic story, and yet unfortunately not one that is completely surprising. I will tell you that part of what we plan on doing, above and beyond the messaging that you see here, on the targeted social and in that expanded grassroots program, is making sure that we're also communicating the wraparound services, as we refer to them, whether they are mental health, food, housing, for evictions. All of those are things that we are seeing are needed more and more these days, how to address the digital divide. And so wherever possible, we will include those messages within some of the channels that we have identified.
And Gail, like we are also working on the some of the refugee communities, right, to message out with the help of the International House, like with so that Jonella and all. So once we have it, we should also reach out to the Bhutanese Nepalese community, which Mark also has highlighted recently in one of the town halls. Has been really impacted because there are like a couple of deaths or more than 80 families impacted. So that is another community we should provide some help, especially around the wraparound services that you're talking about.
Absolutely.
Yeah, thank you for that, Mohammed. And we're going to be bringing a proposal to the board tomorrow night to use some of our federal money for crisis intervention services for people who might need that. So we're going to be working on that from the service end, but we can also go back and look at resources that we have internally in the county to see what we can do to push some more information out around that. That's a really important point, Mohammed. So thank you for bringing that up. It's definitely one of the issues that we're facing as a result of this virus. So thank you for that. Other recommendations, questions for Jennifer, Gail, or Danny?
Dina, this is Uday again here. Not a question directly to Gail and Jennifer, but this is a request that I put in for mass. There were a lot of requests coming within the communities, especially the special immigrant or the refugee community and the Native American community, right? They were looking for mass, and also some of the South Asian communities, they're looking for mass. And I put in like 2,000 requests, 2,000 packets. So far, I haven't got a response back from the atrium. So since Carol is here, I wanted to bring that up. I can share that email out again, because some of these businesses, because most of these people, they don't have the vehicles to go and pick it up from by. I've sent them the numbers and places and addresses and all. They say like, why can't you just get them? And so I have done a fundraiser recently to do some buy some masks and give it to these people, but those are going to last only for so long. I mean, I did buy 500 masks myself for the Native American community, because they were desperately in need. Because we don't talk enough of the indigenous people, but they are suffering a lot, in their communities as well.
Thank you, Uday. We're going to talk about as in our next agenda item, but if there's an email request that you sent, if you could send that to me. There's a specific portal that they need to use to request those, but if you send it to me, I'll make sure that it gets addressed. So
I've
thank you for that.
I've already put in my request in the portal as well. I got the link. It's almost 2 weeks now.
Okay, can you send me the email then so I can
Yes.
follow up for you? Thank you.
Yes, I will.
Up on the media campaign comments.
Let me just stress to support what Uday is requesting. We are working with the state as well. And I will tell you that I think that we have all underestimated the impact of immigrant workers and historically marginalized populations that are working in jobs that are essential jobs, and we are encountering them on a daily basis. And their employers very often either are requiring that they work, regardless of if someone has been identified as being exposed, and regardless if they themselves are sick, or they feel compelled to work because they don't feel that they have other options. So while I understand that the immigrant community may seem like a small portion of the population, it is critical that we address those hotspots, exposure to their broader community and to our community. And I will tell you that within that population, one of the things that we quite frankly had not thought that much about was the fact that very often these populations have children. It's very difficult to find for children. So, I fully support Uday's request and really just can't stress enough to the group that it may seem small, but it actually is critically important that we address that segment.
Thanks, Gail. I appreciate that. Any other feedback for Gail, Jennifer, or Danny on the media campaign? Okay. Well, thank you for that. I think it's awesome. I can't wait to see more of this stuff get pushed out. I think, I think it's having an impact, and I think the more we do, the better off we'll be. So I'm very excited about that. So let's move to the next item, which is this mask initiative. As everybody probably knows, Atrium Health, in conjunction with the Charlotte Executive Leadership Council and Mecklenburg County, are pushing out 2 million masks to the community. Atrium is the lead on the distribution side. There's 3 phases or 3 tiers that are being worked on. The first tier was to work with vulnerable populations, and about 650,000 masks have been distributed to date through a series of nonprofits, through pickup events, drop-off events, have been pretty widely distributed. And the second tier is focused on small business. And these tiers will overlap as we go. So we'll continue to do distributions to vulnerable populations like the ones Uday has referenced, as well as others. But then we're going to start to expand the distribution. And so the next one would be small businesses. And then the third one would be to do sort of mass distribution and to fill the gaps where we feel like we've missed certain areas. And so we're just getting ready to tee up the small business portion, and we wanted to get feedback from this group about what that might look like. But I know Carol Levin from Atrium is on the call, and she was going to talk a little bit about where we are and where we're headed in terms of mass distribution. So Carol, you're on, correct?
I am. Thanks, Dina. Appreciate it. And Uday, just want to reach out to you, and I know you're connected with Dina now, but sincere apologies for you not hearing back. So we'll fix that for sure. I'm not sure what happened, but thank you for bringing it up, because your request, and these are exactly the things that we need and want to do. So Dina, you gave a great opener. You went through all the things that we did in terms of how we started this and the phases, et cetera. And then right now, so let me just jump into the small business. Then we can go and we can open up for questions, comments, et cetera, because we'd really like your input. And also want to thank a lot of the folks who are involved in this, from CELC companies to others. You've been such great partners on this already, and we're all in this together. We really appreciate it. Could not, we all do it together. That's how it works. But a few specifics on this phase 2 with small businesses. So we've got at least 100,000 masks that are put aside for this phase of it, phase 2 and phase 3 collectively for small businesses. And the biggest thing to note, and we need to get this information out to folks, Dina, so maybe we can I can put some slides together, something that you can then send out to folks. But several things for you to know. So small businesses, we're looking at small businesses as 150 employees or fewer. And that's not a hard line, of course, but that's just, we had to have a guide somewhere, so that's what we're using. Small businesses should go onto Atrium Health's website and request them for sure. And then there's a submission form, as some of you have already talked about, so that's there for you. And in terms of how we're even going about this, we're working, again, with partners. So Charlotte Regional Business Alliance and Charlotte Center City Partners, thank you both. I know folks are on this call, and really trying to start with, interestingly, small businesses, small businesses with a millennial Gen Z customer base. We're getting very targeted, and we know that there are needs there. That doesn't mean that if you're a small business and you're not millennial Gen Z customer base, that you can't get on the website and submit a request for masks, because you can. But that's one thing that we want to start with. And we've got Megan Good, I believe, from South End at Center City Partners, and Allie Hansen from Charlotte Regional Business Alliance are the two people that we've been working with from the Atrium side. And then there's a lot of other work in terms of how we're reaching out and figuring out how to get small businesses directly. So with the Charlotte Regional Business Alliance, again, being at the region, looking at ways that we could get beyond just Mecklenburg County and the city of Charlotte, but into the region some. And then also reaching out to small business coalitions, merchant associations, networks of small business partners. We're trying to think of groups that are already organized that could be an organizing effort in terms of getting these masks distributed. We're connecting with small business grant applicants, collaborating with small business leads at banking centers. And those are just a few of the ideas we have. So in a minute, I'm going to ask you what other ideas you have for small businesses. And of course, we also have a strategy that we're working on for others, for medium and larger businesses too, but really wanted to focus on targeting small businesses first. So, how can you help? There are a couple of different ways that you can help. First of all, send any small businesses that that really want to have masks and want to be included in this to the Atrium website. If you just go onto the landing page, you'll find it. But I think we should probably send something out, Dina, to make it easier for folks. The second way is send contacts for small business coalitions or networks, groups, again, that can be organizing groups to help us get this out rather than, than even business by business. And our Million Mass small business distribution leads are Hillary Crittenden at the Foundation for the Carolinas and Brandy Newman at Atrium Health. Again, we can send you these emails. And then finally, send any other ideas you have for small business distribution to both Hillary Crittenden and Brandy Newman, because we will take all the help we can get in terms of how to get this stuff out. We've got, like Dina said at the beginning, it started off as 1 million. We've got a couple million now. We're really eager to get these in the right hands. So want to hear from you. Questions or comments for Dina or me?
Ideas on how to.
Carol and Dina, this is Michael. Can I say something? Can you hear me?
Yes, please, Michael.
Thank you. This is terrific work, and I thank all of you for the hard work. I wanted to just add to the conversation that in the Small Business Grants Program, of which the city has given the foundation, or actually not given to us, but we're in charge of allocating that $30 million to small businesses. We are going to ask the Economic Development Committee of the City Council on August 10th if, moving forward with the grant applications, they would allow the money that's being applied for to go to PPE for those small businesses. So for plexiglass screens at cash registers and things of that nature. So I just wanted you to know that we're hoping that they will allow that to be an eligible reason that people can apply to that money for their small businesses. So just to add to the collaborative.
So Michael, have you distributing that grant money?
I'm sorry, Dina?
Have you already started distributing the grant money?
We have, and while the money could be used now for PPE, it doesn't actually say, it doesn't list that as an example. So we're just wanting to cover our bases with council on August 10th. We've only allocated 4 million of the 30. We'll be allocating probably another 3 or 4 million this week, but there'll be significant. The majority of the money is still available. And we'd like to be able to put on the application that PPE is eligible for those funds. And while it really is now. Well, go ahead.
Well, I guess what I was thinking is there a way for us to use your database of those small businesses and send the link, the Atrium link, to those small businesses who have applied as a way for them to get masks? Because you're going to be collecting a database of small businesses, and if we can get them the link, then they can just ask for those for free and not use the grant money for purpose.
That's I hadn't thought about that, Dina. That's terrific. Absolutely, we can do that, and that will lower the burden on the money to buy masks. But there are other things like plexiglass and these other things that they still should be doing if they can. But perfect, we'll get that.
Hey, Michael, this is Janet LeVar with the Alliance. Good to see you. I would just also encourage, we launched the Carolinas Alliance Match site, which is intended for small businesses and healthcare systems and frankly, government, anyone else who needs it, to procure those goods from local manufacturers across the region who are producing PPE beyond masks and things like gloves. So those face shields, those plexiglass shields. So it'd be great to just continue the infusion into our local economy so that we keep some of these manufacturing companies and producers also employed and working. Thank you.
Hi, this is Rosario Gonzalez from the Working Chamber. I would also like to add, if you could please add to that list of items that are available to purchase through these grants and loans. I am hearing from a lot of the business owners in the food industry that they are now losing a lot of money because they are needing to purchase a lot of disposable items. For example, the plates, the all of the utensils that they need to use to ensure that they are not that they are using disposable items. So if perhaps, and those are not, they don't see that as operational expenses. It's just an added expense that they never really had before. So if there's a little more clarity to help them understand how they can invest those funds, that would be very helpful. Thank you.
Hey, Dina, this is Mark. So I'd like to add, as we look at the 3 Ws that we've been pushing, I think we're doing a really good job when it comes to the mask issue and really the narrative around the social distancing. What I would like to see us try to solve to is potentially the wash piece of this, of the W. And so as it relates to our businesses, I think being able to supply hand sanitizer as part of the package that we're giving and delivering to them, I think would be really, really valuable, particularly to smaller businesses. And so I would like a discussion around trying to solve to that as well when we have this conversation around masks.
And very quickly,
We can see.
I know that it looks at the data available from the state. One of the things that we're seeing is that while you may have large numbers of cases in Mecklenburg County and Wake County, where the concentration of cases happens to be like in the eastern part of the state, specifically because we have a lot of places there that are meat processing, produce packaging, distribution. And so while we don't have nearly as much of that here, I would encourage county officials to consider what, if anything, can be done as part of your normal inspections or normal dialogue. Those businesses that are in these large distribution facilities with poor air circulation, people tightly packed, not really able to social distance while they're working. And there are certain categories of businesses, transportation and logistics. You've heard about outbreaks at places like Amazon, but those large facilities that have large numbers of people who are considered essential, I think that those businesses may kind of fall through the cracks because they're bigger than what we think of as small, and yet those are very often where the hot spots are. So if there's a way that we can work with those businesses to make sure that they are following the guidelines and that they have what they need for their people to follow the guidelines, I think that would do a lot to helping to put out hot spots.
Thanks, Gail. That's helpful, and we'll talk a little bit more about some compliance issues on the next agenda item. But that's a really that's a great point. Other ideas around mass distribution to businesses that we want us to consider or need to put on our list. Okay, so I will do is as a follow-up to this group, I'm going to send you the link to the portal. So that you'll have that, and please just feel free to, send that to, whoever is in your distribution list that you think can benefit from that, as well as Michael will send it to you, of course, but you'll be able to use your database of small businesses who are applying for grants and send it to them as well so that they can take advantage of that. And we'll follow up with the hand sanitizer and see what we might be able to do around that as well. We'll have to buy it, and we have to see what the supplies are and how we can do distribution around that. And so we'll continue to follow up and keep the group posted on what's happening with the mask initiative. But thank you for that feedback.
Dina, this is Michael Smith. We also have 192 grant applications for small businesses, and we'll exercise the same process as the foundation and get it out to that group as well.
That's great. That's great. The more we can get them out, the better off. So great. We'll definitely look forward to that. So the next item on the agenda today is to talk a little bit about enforcement and compliance. And the Board of Commissioners has tasked me with putting together some additional enforcement strategies around what we're doing in COVID. So there's a number of things that we could be enforcing on at this point. One is obviously the masks. There's social distancing requirements that could be enforced upon, and then of course we have the new alcohol restrictions, which can be enforced upon. And so part of the issue is that, you know, some of the language in some of the executive orders does not have a lot of good enforcement language in it, and it presents some problems for law enforcement. So I'm working with CMPD and the Sheriff's Office to try to come up with some strategies. But one of the things that we discovered after doing some research across the country is that there's a couple of cities, particularly Las Vegas, as well as Allegheny County in Pennsylvania, who have created what we call ambassador programs, where they have non-law enforcement individuals that actually are going out to businesses and providing them with educational materials to help them do better from a compliance perspective. What Gail was talking about, where you go into a business and you help them assess what's going on, and then you give them information around when they need to do to sort of have a safer business environment. And so I'm going to be making a recommendation about this to the board tomorrow night, but I certainly wanted to get feedback from the business community, whether or not you thought that was a good idea, what ideas you may have around recruiting people who might be interested in becoming ambassadors, whether or not you think the business community would welcome this kind of assistance as we move forward. So I wanted to make sure that when I make the recommendation to the board, that the voices of this group are part of that recommendation. So having said that, I'm just going to kind of open it up and see what kind of feedback you have for me in terms of this proposal.
Tina,
Yay,
this is
nay.
Mohammed.
Yep.
Tina, this is Mohammed Janatian. I think the idea is a great one because of the fact that we need to let all businesses know that the county is on their side, not against them. I know I've been doing that the past few weeks with ABC, where the law enforcement and also their CEO have been meeting with a lot of permit holders and getting the message across that we're over here as a tool for management, whereas most people feel like, well, these guys are over here trying to find us doing something wrong. So I think as much as we can do to bring in education and letting them know that you are trying to help them and to get everything open and do whatever they need to do, and letting them know that you're on their side rather than them always thinking that the government is against me. They're trying to prevent me from doing anything. I think it's a fantastic idea to do that.
Thanks, Mohammed. Other feedback? Any specific industry or business type that you think we should be focused on?
I mean, I second.
I think the biggest thing is that we need to communicate to everyone that we're all in this together. That what you as a county manager and everybody is doing, we just need to let everybody know that you're doing all the stuff that you're doing, and some people don't like it, because you're trying to create a situation where everybody can open up. And we have to do some of these things. And I think if we do it in a manner of working with them rather than against them, I think that's very important, because of the fact I have these conversations on a daily basis with a lot of our restaurants and other businesses, letting them know that that their loss is also a major loss for our city and the county, because you're not getting the revenues when they don't have any revenues. And I think they need to understand that a little bit better. So I would be more than happy to help in any ways I can in that regard.
Thank you. Other comments?
Yes, Dina, I would like to share with you that I understand that food stamps are to purchase groceries, and WIC is to purchase items for children. And those food stamp recipients cannot use those stamps or the cards to purchase hot or cooked items. So my suggestion would be, I'm not sure if Mecklenburg County would be willing to revise that policy, because in this current time, there are many people that would benefit greatly if not all of it or part or maybe a percentage of the benefits from the food stamps would allow them to purchase prepared hot meals. For example, I was speaking with a couple. They're from Cuba. Their restaurant is a grocery store. Right next to it is it's a restaurant. They're right on Sharon Amity and Central Avenue, and they have a restaurant. And because the restaurant and the grocery store are together, the food stamp recipients cannot benefit from going into purchasing products there, because even though they could buy the rice and the dry foods and the canned foods, just because there's access to hot food, they are not being permitted or given the license to accept food stamps, because it's believed that the person could use the food stamp to purchase hot foods. So I would just kind of share this because perhaps this is the time to look at to think outside of the box, and think that perhaps this is the right time to revise that policy and permit those food stamp recipients to purchase home cooked hot meals with those benefits.
So I think that's really a great, but unfortunately, those are federal guidelines. And so we don't make those rules locally here. So we'd need to run that up the flagpole at the state and federal level to see whether or not we could. I mean, and they're issuing waivers for all kinds of things. I don't know if this is one they'd be interested in, but, you know, we can certainly give this to our legislative person and ask her to see if she can get some feedback on that. So it's definitely worth exploring.
And Dina, this is the year. I raised this question earlier on in the second or third on the roundtable meeting. Michael Smith mentioned at that time that there is something going on around this food stamps and hot food with at the congressional level. Anything that you have heard, like Michael, of that bill that has passed through? Because this is a common item that most of the people that are on food stamps are asking this question, like, can they purchase hot food? I know these exceptions have been given during hurricanes earlier, but they haven't done that in a pandemic.
Michael, that was to you, Michael Smith.
Yeah, Uday, I'm not familiar with this, but I'd be glad to hear that question again. I have not been looking into this.
No, I think the question was around can food stamps be used to purchase hot food, right?
Yep.
Typically, like in hurricane season, like when the natural disasters happen, they are given created an exception that the food stamps can be used to purchase hot food, right? And you know, when I raised this question earlier on, like you mentioned there's a bill in Congress at that point, you know, to address this. Anything? Have you heard anything after that? If that bill was ever passed, or
I'm sorry,
if this is
I have not heard whether or not a bill was passed to allow that exception. I think that's a good point that with some of the exceptions that are granted during cases of emergency like hurricanes, that we ought to look to that toolkit. Dina, is that something that your government affairs folks could look into?
Yeah, we'll have Charlotte take a look and see if she can't get us some information on that. So we'll follow up. I wrote it down, but it is a great point, and it's to help support local business. So I think there's a benefit for everybody if we could make that happen. So we'll be happy to follow up on that. Anything else on the ambassadors that we need to take into consideration as we build?
So Dina, I want to second what Mohammed has mentioned just now. I think we just need to you know, give confidence to the business owners and you know, bring them to the same table, that the county is working with them and we are in together, right? I mean, we want to open up, but we want to open up safe. Because that's in the best interest of everybody, right? And I think that message can be reiterated, and that will be great.
Terrific. Thank you for that, Uday. And, one of the things that I think is going to be really important is to have trusted voices from various communities. And so as we start to recruit ambassadors, obviously we would like to have people who are bilingual and represent all of our communities. So I'll probably reach out to Uday and to Rocio to help us maybe try to see if we can identify folks that are interested in doing this work, who can go out and help us with some of those businesses. I think that's going to go a long way to helping people feel valued. So more to come on that, but we'll continue to work with you and try to build this out. And of course, I'll get feedback from the Board of County Commissioners at our meeting on Wednesday night. So thank you for that feedback. That's helpful. The next item on our agenda is I just wanted to talk a little bit about the board's Recovery and Renewal Task Force. I think I mentioned this at our last meeting, that the Board of County Commissioners has created a Recovery and Renewal Task Force to help the community on a whole host of different fronts, including healthcare and eliminating health disparities, mental and emotional health, which Mohammed brought up earlier, economic recovery to help small businesses, recovery for nonprofit human service organizations, education and childcare, working families, housing and homelessness, jobs and workforce development, food security, and arts and culture. So it's got a very broad scope of work, but the board did go ahead and they appointed 23 individuals to the task force. The group is very broad in terms of the skill sets that they bring to the table. Really a stellar group of people. List of the folks are on our website. But we're very excited about the people who they've selected. And on Wednesday night, the board will be appointing the 2 co-chairs. There was an ad hoc committee of the board that met last week that interviewed those individual task force members who were interested in being co-chairs. And I believe there were 9 people that we interviewed. And so they'll be making a recommendation on Wednesday night. So the 2 recommended co-chairs will be Victoria Avramovich, who is an Assistant Director for Community and Economic Development at the Central Atlantic Council of Governments. I don't know if you know Victoria, but she's been working in this space for a very, very long time, very strong on community economic development and really knows neighborhoods. I think she's going to be awesome. And then the other recommended co-chair is Dr. Jerome Williams, the Senior Vice President for Consumer Engagement and Corporate Health at Novant Health. So obviously brings all of the healthcare experience to the table. I think they're going to be incredibly strong. So very excited to get the work started. And once the board makes final appointments as the co-chairs, then I'll be reaching out to them and we'll be getting organized. But because of the broad base of what they'll be working on, really we'll want to tap into the expertise of this group to help formulate some of the direction that they take as they start to do their work. So I just wanted to give you an update on that. I don't know if anybody's got questions about it, but I wanted to make sure that we've kept you up to date on the activities of the task force. So very excited about that. If there's no questions on that topic, we're going to move to Gibby, who's going to give us an update on the data. We just did a data release this morning, so the data that's hot off the press. I think she's got some potential good news to share. So with that, I will go.
Good morning, everyone. So I'll do this quickly. We have currently 21,193 confirmed cases. We've had 222 deaths, and we have 37 congregate living sites that are in outbreak status at the moment. And remember that outbreak status is 2 or more staff and or residents. So there's a low bar for outbreak status. The good news, our positivity rate continues to go in the right direction. Over the 1 week period, this past 1 week period, we have dropped to 8.9%, down from 9.6% the week before that. And if you'll remember, we've been hanging in the 10.5% rate prior to that. Our hospitalizations are down as well. These are two of our trends that we watch regularly, and we are keeping everything we have crossed to make sure that they're continuing to go in that direction. And obviously, the work that y'all are doing with small businesses as well as with the campaign are going to continue to help that. The one issue that we continue to see are an increase in the number of deaths that we've seen over the last week and a half. But that particular indicator is a lagging indicator, which is probably indicative of some of the increases we saw in hospitalizations there for the last month. So we're hoping that that will continue to move down and not up. One of the things we are seeing is increased percentages of new cases among those under the age of 20. So we'll need to stay on top of that as well. And of course, our 20-somethings have been our greatest percentage of cases since the beginning, and that continues to be the case, which just reemphasizes the need for our businesses, our restaurants, places where people can congregate are doing what they need to do to help us make sure that that we're masking and that we're social distancing. One thing that has been seen across the country and is that mass gatherings are where our biggest concerns are in terms of increased exposure and potential cases. So again, the enforcement piece, which for us will be more of an educational component, an opportunity to engage our businesses and our restaurants to be partners with us and making sure that we're continuing to see these numbers move in the direction that we want to. So I'll stop there, Dina. I'll be happy to answer any questions if there are any.
Questions for Gibby on our latest data?
Gibby, this is Clay Armbruster. What if you and maybe Carol or anybody else from the hospitals are seeing in terms of test turnaround, which is a big factor for a lot of folks once people are exposed? How's that going?
We did have some issues over the last couple of weeks with that turnaround rate going up. We got in on a couple of days, we got up to as long as a 10-day turnaround time. But that has come down significantly. Our labs have increased their capacity. And so right now we're seeing many of our test results coming back in 24 hours, but 72 hours seems to be the outside at this point. So that has improved significantly, and we just need to stay focused on that as well. Thanks for asking that question.
And Clay, this is Carol. So on the health system side, because we're working together with the county, but it's a little different. We focus, of course, on our patients first because we have to, and then work with everybody else as best we can. But just literally covered that this morning in a couple of meetings, and we've got, as I know Novant does too, but we've got different machines that run these things, and we both have machines that turn this around in that could turn it around in a few hours if need be. But the thing with that is we are given so few, these things are called cartridges, and each person needs a cartridge, and they're given so few that we can't do very many in a few hours. But what we can do, and I won't speak for Novant, but what Atrium invested in is a Roche 8800 at the beginning of this pandemic. And that's the one that we try to get things turned around in 24 to 48 hours at the latest, because we can run high volumes. And again, it's not the analyzer that's putting the slowdown on things. It's the reagent kits for that machine. So we're all working, there are just so many parts of this distribution, this supply chain that get us, but that's generally where we are and trying to get better and better.
I mean, the other thing that we've seen recently is that, every time the state encourages us to increase testing, it puts more strain on the laboratories outside of the hospital system. And then it takes them a little while to catch up and to get their capacity up so they can address the additional tests that we're seeing. And we've seen that. We've been through 2 iterations of that already. So hopefully the next time the state encourages us to increase testing more, and we're all looking to increase the availability of testing, is those labs can get ahead of that so that doesn't become an issue. And that's outside of what the hospitals can do because they are limited with the reagent that they're receiving.
Great. Thank you both.
Other questions for Gibby on the data? All right. Well, again, another great meeting. Your feedback and contributions are always very helpful for me. We will continue to follow up on these things, and we'll reconvene soon. Anything that comes up in the meantime, please feel free to reach out. It's always good to see all of you. I appreciate you taking the time to help us with all this. So have a great rest of your day. Thanks.
Thank you, Dina.
Thank you. Bye-bye.
Thanks, Dina.
Bye. You're welcome.